All right, guys, how are you? Guys, remember to take your names off of your Zoom. All right, just change your screen name. You can change it to you can change it to whatever you want. Just try not to use your name, okay? All right. So good day, and let's begin. Okay. All right. Just let me know if you guys can hear me. Okay, good. All right, we're going to go over the NCSBN test plan today. Yesterday, we went over the binder, how to get yourselves organized. The binder, the 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 recording is up on YouTube. So if you missed yesterday, you can go to YouTube and listen to it. We talked about the 15 dividers and what we should put in each divider. All right, give me 1 second, guys. All right, make sure this thing is on. Rocking. All right, guys. So you guys know that is every Saturday and Sunday. So next Saturday and Sunday, we start with health promotion and maintenance. So throughout the week, look for like the worksheets that I think that will be beneficial for health promotion and maintenance. File it under your health promotion and maintenance tab. Okay, it's going to be quite a few worksheets for you guys. I think you'll like it. All right. Remember, because you can buy another book on health promotion and maintenance, but I feel like if you do active learning exercises, it just sticks longer. You retain the information longer. Okay. So, divider number 15 is the actual NCSBN test plan. So you have the PM edition and you have the RN edition. Let me pull up the RN edition. You have both. So this is where you should start. After you have your binder together, your 4-inch binder, you have your dividers. Now, number 15, the section 15 is your actual true study guide. So every exam, every standardized exam, like the NCLEX or no, I'm sorry, like Saunders, Kaplan, Archer, UWorld, they all get their information from here. They get their guidance from this website, so from this test plan. So let's say, for instance, today we were getting together because we all decided to make a NCLEX review, like write questions for the NCLEX. How do we know that we're giving students the proper NCLEX review? Well, if you go to class, if you go to school A, nursing school A, they focus on searching things. If you go to nursing school B, they focus on certain things. Nursing school C, they're focusing on certain things. How do you, like, it seems like everyone is learning something different, but we're all learning the same thing. It just seems to be all over the place. So if you go to school A and you talk to somebody in school B, you're like, wow, wait a minute. I know I heard of that, but they don't really focus on that in my school. You know what I mean? So you have to be very aware of that. If you really want an NCLEX review, if you really want a solid NCLEX review, you have to go to the source. So ideally, all of the schools should use this plan to develop their curriculum. They should use this plan when they're doing NCLEX reviews. This is what they should be using. All right. This is to ensure that we're all on the same page. All right. So safe and effective care environment is the first client need area, the first important client need area. So take a look at it. All right. And I hope that you guys were able to actually print. If you work in the office, take the time to print this out. This is your guide. This is what I use to help you. This is what all nursing schools should be introducing to the students on the first day. This is your foundation. So safe and effective care environment. For those that have taken the board before, I know you have seen this safe and effective care environment on your results. All right. So management of care is one area of safe and effective care environment. So this is going to go under, now we're going to talk about management of care. All the notes that I'm suggesting for you, I want you to file them under your management of care tab. Okay. Now I'm going to suggest some things for you. So management of care. The nurse provides and directs nursing care that enhances the care delivery setting to protect the client and the healthcare personnel. So, management of care is in place. It is the biggest piece of the puzzle. It is one of the most important pieces of the puzzle because it ensures the protection of the client and the healthcare personnel. So, it protects the client and it protects nurses. So the Florida Board of Nursing and the NCLEX, they need to know, you understand that these are the things that you are responsible for. There's no ifs, ands, and buts. They're not saying that you have to be perfect, but they need to know that you know enough to protect yourself and protect your clients when you're on the floor. So management of care. First thing is integrate advanced directives into client plan of care. So advanced directives, I want you guys to underline that or write or put a red mark next to it. If you know it, if you feel comfortable with it, give yourself a check. You got it. If you understand advanced directives, then guess what? You got it. You know advanced directives. If you get a question on advanced directives, 9 times out of 10, you'll get the question correct. If you have no idea what advanced directives are, put a red X. So this is where you're going to begin, advanced directives. You are going to read about advanced directives. You're going to listen to videos about advanced directives. You're going to download images of advanced directives because advanced directives is on your exam. All right. So integrate advanced directives into client plan of care. I will send you a copy of an advanced directives. And for those that have just joined within the last 2 weeks, I'll send you the lecture and the actual worksheet that we did for management of care. But I will send you a blank advanced directive so you can look at it, so you can truly understand. Because according to the NCSBN, we are responsible for integrating advanced directives into the client's plan of care. It is the first thing. So I know about advanced directives, so I'm going to give myself a little check. Because I'm very familiar with advanced directives. There's really no way that you're going to jam me up on advanced directives. So assign and supervise care of client provided by others. So this is our big thing, is assigning and supervising care. That's us. All right. So can you honestly say, if you get a question on assignments and supervision, you will do well? I'll do pretty good in this area. I know that if I assign, that means that I am assigning not only the task, but also the authority. Whoever is assigned to that patient, now that's their patient. So when I go to work on the floor, I get my assignment. Another nurse gives me my assignment. My charge nurse gives me my assignment. So now I also get the responsibility. I am also accountable. All right. So LPNs, VNs, you guys will be responsible for supervising the care if you delegate it to a CNA or UAP. You guys know that. And assistive personnel, you are responsible for, all of us are responsible for supervising assistive personnels. Now, the big thing here, I want you to write it down. You have to know how to supervise, the rules of supervision. So write that down. That's going to be, and it's memorization also. So what are the components of supervision? You have to write that down. Put it on the page. Make a little worksheet. The components of supervision. That's a very easy select all that apply. You have to know all the areas or all of the components of supervising. So this one is memorization, guys. Okay. So I would probably do very well on that. So I'm going to give myself a little check mark. If you don't know it, that's fine. Give yourself an X. You know for a fact that you're going to study supervising care of the client. Okay, organize workload to manage time effectively. So that comes from, basically, you may want to read ATI for this. It's also in the worksheet that I gave you guys. You have to know to start with the high demanding personnel or whatever requires the most energy. You want to do it when you are the most energetic. All right. And believe it or not, for this organized workload to manage time effectively, you're supposed to write down your shift. You're supposed to write down a step-by-step instructions on, okay, I'm going to do this at 7 o'clock. I'm going to do this at 8 o'clock. I'm going to do this at 9 o'clock. I will send you an example of how to organize your workload. And it's real. All right. It's real. So organize the workload to manage time effectively. I'm going to give myself a check mark. Practice and advocate for cost-effective care. One of the best, the main things for cost-effective care is making sure that the patient has case management on deck. You have to consult case management. You have to know that case management is on the patient's case, because there is a strict discharge We can only stay in the hospital for so long. There's strict discharge procedures, and the case manager will make sure that this person is in, this person is discharged within the appropriate time frame. So cost-effective care for nurses is knowing everything about their case manager. All right? And also knowing about your PPE. So this is where they're going to get you a PPE. So ideally, guys, when I know you guys have gotten that question about hand washing or gloves, when should I wear gloves? That's real. You really need to know in our theoretical NCLEX world when you should wear gloves and when you do not have to wear gloves. So for practice and advocate for cost-effective care, that's gloves. When should I wear gloves and when should I not? When do I have to put on my goggles? When should I put on a gown? That saves money. So practice and advocate for cost-effective care. Case manager. Know exactly what a case manager does. Look at a video. Embrace what a case manager does. Read about case management. All right. Initiate, evaluate, and update client plan of care. I'm going to give myself a check mark here because that's kind of my thing. I understand. Can you guys hear me okay? Okay, Miss West, just go in and go out the chat and then come back into the chat. That'll help. All right. So initiate, evaluate, and update the client's care plan. This means that if a client gets better, you update. If the client gets worse, you update. All right. We're always changing our care plans. So I'll kind of just give myself a plus. I can initiate, evaluate, and update my client plan of care. Provide education to clients and staff about clients' rights and responsibilities. So, guys, you have to make sure that you know, make a note card or a worksheet and test yourself on clients' rights. When do clients, and most importantly, they're going to give you a question on a mental health patient. Let's just keep it real. A competent versus an incompetent client. An incompetent client is deemed by the court system that they are incompetent. As a nurse, I can't go in someone's room and say you're incompetent. You're not going to sign your DNR. Who am I? I need a court order. All right. So when it comes to provide education to clients and staff about clients' rights and responsibilities, I know for a fact that they're going to give you a question with a mental health client. Does that client have rights if they are voluntarily admitted or involuntarily admitted? And I can tell you what the answer is. The answer is they have rights. They have a right to refuse. All right. So for this one, I want you to make sure. I'm just going to go ahead. Let me just put numbers so we don't confuse ourselves. For number 6, for NCLEX question number 6, client's rights, and know that a mental health, if a client is admitted for psychosis, schizophrenia, it doesn't matter. The client has rights. Client says no, it's no. The only situation where you can, if the content of the question or the stem of the question is the client is trying to hurt you or hurt himself, then we have a little more liberty to put the client in restraints, or we can use physical restraints or chemical restraints, and we have like an hour to get an order from the physician. That's it. So clients have rights. If a client says no, I'm not doing that, then it means no. Okay, so remember that. That's going to be a mental health question. Advocate for clients' rights and needs. I want you guys to think about DNR. Okay, if the patient walks into if the patient is admitted into the hospital and the patient is a DNR and it's signed and it's in the chart and the physician signs it and the family is saying, nope, he is not a DNR. I want you to do resuscitation, do whatever you need to do to save him. We have to advocate for the client. Also, advocating for client rights and needs. Do you send a client home without an oxygen canister? Or can you send a client home and the client cannot care for himself? So how do we advocate? We make sure that the client has everything the client needs before they are discharged home, especially oxygen. So that is the question 7 that's going to be like, they're going to attach that to maybe a discharge planning. And also if someone says I'm a DNR, but the family member is saying, no, he's not a DNR. Question 8, collaborate with interprofessional team members when providing client care. The biggest issue here is knowing who is the interprofessional team. Like who is a speech therapist and what does she do? Who is a speech pathologist and what does she do? Who is a physical therapist? So interprofessional team, this question, they want to know, you know, everybody on your team and you know the role. So for number 8, make a list. Speech therapists. What is the responsibility? What's the scope of practice for speech therapists? What's the scope of practice for speech pathologists? What is the scope of practice for physical therapists? What is the scope of practice for occupational therapists? And make sure you know case manager. What is the scope of practice for a case manager in a hospital? 9, manage conflict. I want you guys to write down, this is just memorization here. There's a step-by-step process when you are dealing with clients and conflict. And it's mostly, this is going to be between you and your team members. All right? Manage conflict between a team. How do I handle a problem? How do I handle if I have a disagreement, on the floor? How do we keep it professional? So you guys are in luck. All of your books, if you use Saunders, if you use Pearson VUE, if you have your ATI, it's time to, pull that thing out and write down the step-by-step conflict management. What do I do first? What do I do second, third, fourth, fifth, sixth? So I'm the queen of conflict management, the queen of conflict management. It keeps me very calm. It keeps me very collect because I don't have to get emotional. When I know someone is doing something unfair to me or someone is being unprofessional, I follow the steps. It just puts me at ease. So you have to learn the steps so you're not yelling, so you're not screaming, so it doesn't turn into a physical altercation. So this is huge for the NCLEX. If the NCLEX allows you on the floor working with the amount of nurses that you're going to work with, the interprofessional team, can you handle conflict correctly? And it's a win for us because it's just memorization. Step 1, step 2, step 3, step 4, step 5, step 6. That's it. If you know the steps, you're good. You'll get that question correct on the board. Client confidentiality and privacy. This one is a hard one because they want you to know about that computer. How do I log off? When should I log off? Should I give someone my password? Should I share information with clients or other team members if they're not working with their client, if they're not assigned to their client? So how do we protect our clients' privacy? We don't allow other people to look at the chart, especially if they're not caring for their client. And the big thing is log off of your computer if you see someone is trying to look at the patient's information, and never walk away from a computer that has patient health information. Okay, that's 10. 11, question 11 could be handoff of care report on assigned clients. They want you to know now that you have to tell them what information should I pass along. So if you the worksheet that I'll send you guys, it has the criteria. Now is the best time to look at ATI. They will tell you all the information. They even have a blank copy of what you should transfer your patient. What's the information that's needed to transfer a patient? So handoff reporting is good. Also remember SBAR. Okay? Remember SBAR. If worse comes to worse, situation, background, the assessment, and your recommendations. So if that patient has a lab that needs to be drawn, or if that patient is Q2 neuro checks, that's the type of information that should be transferred. Approve abbreviations, guys. Approve abbreviations. I will send you the copy of approve abbreviation. And believe it or not, I took a test for travel nursing and I had to realize or, embrace real quick. You cannot abbreviate medications, not even morphine. You cannot do it. I have a copy for you. I'll send it to you. I even bought a pocket nurse from Amazon. If you want to go to that extent, it'll be very good. It'll be very helpful for you when you do get on the floor. It gives you a list of approved abbreviations. And guess what? We cannot abbreviate meds. No, it threw me off. Okay, so this is huge. Use abbreviations. You can just Google Florida approve abbreviations, but this is something that I'll send you. Perform procedures necessary to safely admit, transfer, or discharge a client. Please believe it. Please believe that you have to know what to report. For number 13, this is going to be a doozy. All right, so embrace it. Start thinking about the procedures necessary to safely admit, transfer, or discharge. And most of this is just knowing what information has to be transferred. If you look at the worksheet that I sent you guys when we did management of care, it's a very, very good breakdown. It tells you all the information that you need to admit, transfer, or discharge a client. So 13, guys, is a doozy. I'll give myself let me give myself some credit. Pretty much so far so good for me. I don't know about you guys, but I'm doing great right now. All right. Now, prioritize the delivery of client care. Now, I recommended a book about prioritization. It was in our lecture. I think it was last week, Friday. There's an entire book dedicated to prioritizing the delivery of care. So I can tell you guys this is going to be threaded throughout your exam. They're always going to put your airway client against your bleeding client, against your client that has circulatory problems. And they want you to tell them, who should I care for first? So put times, if you're going to get 100, and I think the board is 175 questions now. How many questions is it now, guys? The max. What is the max amount of question? 145. So if I have 145 is my max, if I get the max amount, I would say, let's just say 9. Let me just say, I'll say 120 going to be prioritized. You got to know, you have to know how to prioritize your client. You will never get one patient. Even when you are if you're an ICU unit, you can get 2 patients. on orientation. So this week I'm doing orientation. So let's start you off with 3 patients. It's never going to be one. I mean, if you work for a facility that will give you 1 patient and then 2 patients and then 3 patients to see how well you're progressing, then consider yourself blessed. But when you hit that floor, you're going to get at least 1 to 3 patients. And they want you to know who to prioritize, who goes first. So prioritization is what we do all day. Sometimes room 5 is more, requires more care, and then 2 minutes later room 2 requires more care, and you got to switch up your plan of care. You have to switch up your routine just like that. It happens just like that. So prioritize the delivery of client care. If you're like a tactile learner, if you need something in your hand, if you need something tangible, get that prioritization book. Okay? It will help you. It breaks down every system. It helps you start thinking about prioritization. Also, Saunders has priority questions. You can do strictly priority questions in Saunders. So this is the doozy here. Number 14. That's you. That's your exam. So they can put farm, they can have your system disorders, they can have diagnostic procedures, they can use every type of question, lab values, to make sure you can prioritize. So this is what we do. All right, this is why the board is hard. Number 14 is the why. That means that you can apply all of this knowledge that you've learned in nursing school and you can prioritize your client care. Recognize ethical dilemmas, guys. They love to put non-malfeasance versus malpractice. Okay? What is the difference between non-malfeasance? What is the difference between malpractice? You got to know it. All right, do a little worksheet, videos. You can listen to my lecture from 2 weeks ago. Ethical dilemmas. We know about veracity. We know about non-malfeasance. We know about malpractice. All of them. All of our ethical principles. Now that is when you will have to apply your ethical principles. All right. So that's your ethical principles. Just go over them. Practice in a manner consistent with the code of ethics for nursing. Again, non-malfeasance versus malpractice. So let's talk about the Good Samaritan. Good Samaritan versus me being a nurse. So I'm a Good Samaritan and I'm a nurse. All right. So if I see someone and they're injured, I am only allowed to do what a nurse can do. You see what I mean? Like if I'm a Good Samaritan and I notice that, I hate to say it. Let me just knock on wood. I don't like to say these things, but I don't like to speak it into existence. But if I'm a nurse and I see someone whose heart has stopped, I can do CPR, but I can use the AED, but can I perform open heart surgery and massage his heart? Absolutely. So, absolutely. All right. Absolutely not. So, code of ethics for this, what number? 15, 16. Okay. 16. Good Samaritan versus what I can do. Also, if a client tells me that if he says, listen, you can throw away that DNR, I need to throw away that DNR. Okay. When it comes to consents, I can witness the consent, but I cannot go into a room and tell the patient everything that they need to know, the risk versus the benefit of a procedure. I cannot do that. So Good Samaritan, knowing your codes of ethics, also knowing about advanced directives. I need to respect the client's wishes. All right, 17, question 17. Verify, and I want you to underline verify. The client receives appropriate education and consents for care and procedures. So I'm verifying that the client knows why they're having the surgery. Let me just give you an FYI. Some facilities don't even want nurses getting consents. Now the doctor has to go in and get the patient to sign it. They don't want that. They want the nurse completely out of the loop. Go in, get your own consent signed. You're going to do the surgery, go talk to your patient. So verify the client receives appropriate education, because we need to know, you do know why you're going down to this procedure, right? So I tell my clients over and over and over again, you know, you know why you're going down, or you know that you're going to be leaving in an hour. Do you know where you're going? I need to know. All right. It's my job to make sure this client is not going down for a procedure and they know nothing about it. Receive and transcribe healthcare providers' orders. So let's talk about this guy here, and let's put number 18. That is another major, that's a heavy hitter. You cannot be a nurse, guys, and you don't know how to transcribe orders. You have got to know the components of an order. So I always use the acronym TRAMP: time, route, amount, the med, and the correct patient. And then, of course, you're going to document. So I always use the acronym TRAMP. So you have to know how to transcribe healthcare orders. Also, if it's a phone order, it's in our theoretical NCLEX world, get another nurse to witness it with you. And the doctor has a certain amount of time, usually 24 hours, to come in and sign his name under the orders. So this is huge, guys. If in order, like the NCLEX is testing if you are a safe nurse, a safe first-year nurse, not a safe 2-year nurse, not a safe 3-year nurse, not a 4-year nurse, just a first-year nurse. And one of the things as a first-year nurse is you're going to take orders, and you have to know how to transcribe orders. Okay, so that's huge, guys. That's a heavy hitter. All right, that's one of those heavy questions, those heavy weighted questions. All right, utilize resources to enhance client care. So you have to know about evidence-based research. Believe it or not, they want you to know about evidence-based research, information technology, because everything is electronic now. All of our charting, our vitals, and policies and procedures. Just if you have an issue with 19, just go back to my lecture, Management of Care. It talks about, it goes into depth, evidence-based research, information technology. I think you'll like it. All right. Yeah. That area killed me on the boards, all in. So you have to look at that video over and over again, because this is I know this isn't like cardiovascular, and this isn't nephrology, or this isn't the GU, GI, musculoskeletal, is not the skin, is not hematology, is not, I don't know, interesting. You know what I mean? It doesn't hold my attention. Information technology and policies and procedures, like, man, whatever. But guess what? The board is like, oh, really? So you're not going to study what I told you to study? Oh, okay. Well, let's see how you do then. Let me hit you with a select all that apply, since it's not important to you, because it's important to us. Okay, I know you want to just read about the heart and the kidneys and the skin, but I'm telling you, the NCLEX, they want you to know about evidence-based information technology policies and procedures. Okay, so these questions here, once you get the foundation of evidence-based practice and information technology, it's going to be very difficult for them to trick you. All right, and they love to give you, just like Ms. B said, they're going to give you a lot of select all that apply, because they can they can get very creative with these guys, and they're not going to stop though. So once they give you one, they're going to give you another question, and then they're going to give you another one, and then they're going to give you another question, and then they're going to give you another one. So 19 is a real doozy. 19 can make you or break you, because they know we're not going to read it. We're not going to study it. If I have a study session, I will never have a study session about evidence-based research, information technology, and policies and procedure. And they know that. All right. So also, there is not one facility that you're ever going to walk into where you don't have to use information technology. Every first year nurse is going to use a computer. That's just it. If you do home health, if you do hospice, it doesn't matter. Whatever field or whatever area you decide to work your first year, you are going to use information technology. Evidence-based research is important, because you're not out there getting creative and making up your own wound care, or doing your own Foley care, or just things. They want you to know everything that you do is grounded in evidence-based research. That's from day one. Okay, recognize limitations of self and others and utilize resources. This is delegation. These are your delegation principles now. Delegation and supervision. Okay? This question is huge. They want you to delegate. You're not an effective nurse if you're trying to do everything yourself. You're not an effective nurse if you give your assistants or your UAPs too much. Can they handle it? Are you using her correctly? All right. And that was a question on the board. All right. Is that assignment a fair assignment? Report. Oh, so that's 20. Now we're on 21. Report client's condition as required by law. So report client's conditions. This is abuse and neglect. It's very interesting what you learn about adult abuse and adult neglect. So how I treat a 28-year-old woman is very different than how I would go about a 2-year-old being abused. But the one thing that you guys have got to remember, follow your chain of command. Okay? So if I have a child that's being abused, I don't want to go to the authorities first. I want to let my charge nurse know. All right? So no one, if you're a charge nurse, most of you guys, your first year on the floor, guess what? You're going to be a charge nurse. And I know you would not appreciate the police walking into your building and you have no idea why. So the big thing there is to follow your chain of command for 21. Abuse and neglect, communicable diseases. You have to know, this is a doozy. I have a worksheet for communicable diseases. You have to know what you have to report. This is something I don't need consent. I don't need consent when it comes to communicable diseases. I don't need it. Okay? I have to report it to the CDC. The patient doesn't have to give me consent. Now, the board, they're going to give you the most random communicable diseases ever, things that you have not heard of. But guess what? It's in the community. So I'll send you the worksheet for communicable diseases and actual copy of the communicable diseases. And I want you guys to study them because it's a question on the board, especially Shagilla. Provide care within the legal scope of practice. What is your legal scope of practice? I'm going to send it to you. It's chapter 6. The Florida Board of Nursing provides it for us. It tells you what you can and cannot do. And you have to read it. And the board is going to hold you accountable. So what is my job? What is my legal scope of practice? So there's certain things that I'm not allowed to do. And I also have to make sure that I'm not delegating things to people who aren't allowed to do certain things. Participate in performance improvement projects and quality improvement processes. Now, this 23 is a doozy. 23 is on the board. All right. I know it's not as interesting as cardio, GI, GU, but it's on the board. So I like performance improvement projects because it's just memorization. So it's a step-by-step process. Look at the worksheet that I sent you guys. Is there. This is big. 23 is huge. And question 24 is referrals. You can initiate referrals in our theoretical world. All right, that's home modification. So if a patient needs a ramp, guess what? They need a ramp. They get a ramp. If the patient needs home health nurse, the patient gets home health nurse. We are allowed to initiate referrals. And this is also dealing with case management. You have to know what's the role of case management. So basically, guys, for 24, you never, ever, ever leave a patient without the resources that they need. We are here to provide for the patient. We can do home modifications. We can go home with the client and look at the house to make sure the house is safe, to ensure safety. All right. It is a part of our job to initiate referrals. Okay. So that's that. How did you guys do? Let me put my checks. Let me see how. Do you guys, so out of the 24, how would you guys rank yourself? Like what percentage do you think you're good? I think I'm about like at an 80%. I think I'm good on this one. What about you guys? 6. Okay. So now, but at least you have a baseline, right? At least you know where to begin. Am I right? So when I send you these little flyers and I send you all this little stuff that I snatch and I grab, you'll know where to file it. It goes under management of care. I want you guys, when I send you these things, these little, because I go everywhere. I always have my ear to the streets. Now you know where to file this information. So if I send you something about clients' rights, file it under clients' rights, and I want you to study it. I also want you to now take a look at your ATI book or your Saunders book. Commit to one. But these are the areas. I want you to start with the areas that you have an X. What's the point of reading the entire book? You got it. You're at a 60%. Reach for that 40% that you don't know. So this is your guide. I'm at 80%. I know what I need to review, and I'm going to review what I need to review. I'm not going to try to relearn nursing school. And guess what? You know more than what you think. So this is the biggest piece of the pie. So I'm going to master this. I need to get every management of care questions right on my board. I need to get that. I need to get every management of care question right. Yes, you can use that. You can use it as a reference because they use the NCSBN. They go by the NCSBN to the T. Yes. But if you need a little more, so let's say, for instance, if you need more explanation, if you need a little bit more information, use your ATI book. It's the thinnest ATI book, that management of care. It is the thinnest workbook that we have for ATI. Use it. It's an excellent resource. And you'll start to see, you're going to say, man, this is just like the NCSBN test plan. Yep. So this is our biggest piece of the pie. We're not going to overlook this ever. Everything. I need to be at 100 on this. No excuses, because this is going to provide me a cushion for these other areas. All right. So you got your management of care. Oh, guess what? It tells you even more. Related content includes, but is not limited to. Look, they tell you advanced directives. They're going to give you a question about advanced directives. They want you to know about self-determination, or they may use the term life planning. These are the terms that you're going to see, and you won't be thrown off because you know they're saying, oh, they just talking about advanced directives. So it says assess client and or staff member knowledge of advanced directives. So it's telling you the question. So question 1 will be assess the client or staff member knowledge of advanced directives. So they're going to give you a scenario. They're going to give you a patient, and they may give you a patient with a system disorder, and they're going to give you lab values, and they're going to tell you the patient's demographic. But they want you to just know how to assess the client's knowledge of advanced directives. Even though he has all this going on, they need you to understand the stem of the question is those advanced directives. So they'll give you a question about living will. You guys know that's when the patient is alive and can and within a good sound mind, sound body. They can make decisions before they become unable to do so. So a living will is something that we usually do when we're healthy, we're clear, we're alert and oriented. So that's when you normally fill out your living will. A healthcare proxy, you can get a question on healthcare proxy. And you can get a question on power of attorney for healthcare. So these all fall within advanced directive, self-determination, life planning. The board is telling you, I'm going to give you a question. I can give you a question on advanced directive, self-determination, and life planning. But let me tell you how I'm going to hit you. I'm going to get you with living will. I'm going to get you with healthcare agent proxy and power of attorney. Healthcare agent proxy, guys. You can have $1 million healthcare proxy. That patient, the healthcare proxy, could be making $1 million or whatever that client chooses to pay his healthcare proxy. Guess what? I work for the client. I work for the patient. So even if the healthcare proxy is sitting there and this patient is not deemed incompetent by a judge, I don't care what the healthcare proxy say. It has nothing to do with me. I have my patient right here telling me what they want or what they do not want. And that is where the conflict, that's where the question, that's going to be the stem of the question. You can change your life. You can plan and change your life as much as you want. And the patient can too. Integrate advanced directives into client's plan of care. So that means that, okay, sir, you are going to get furosemide. You're going to get your potassium. I'm going to do an IV. And then this patient codes, code blue. Okay, I'm going to integrate the DNR. Do not resuscitate. That's what they mean by integrating, meaning do you know that this patient has a DNR? What if the patient does not have a DNR? Then I need to do CPR. So integrate advanced directives into the client's plan of care is saying patient is a full code. What does that mean for us? CPR. Patient is a DNR. What does that mean for us? If the patient codes, I am not going to do CPR. I have integrated the advanced directives into the client's plan of care. Let's say, for instance, the patient has a healthcare proxy, right? And I know my patient is not alert and oriented. My patient is just alert to self. That means that I need to call the healthcare proxy when I need to make a decision or if I need an answer about this patient's plan of care. I have integrated the client's plan of care, well, integrated the advanced directives into the plan of care. But remember about advanced directives, that it's the client. The client is number one. Provide client with information about advanced directives, self-care determination, life planning. Guys, I'm going to send you a self-care determination flyer so you'll see what it looks like. We all get it. Whenever we go to the hospital, you know how they have you to sign those forms saying that, oh, I know that you are going to help me. I am not signing up for any research studies. Don't use me as an example of nothing. I am here only, and my information is only to be used for my health care. I decide. Okay? And so does the patient. Just put yourself in that patient's shoes. What if you had a mental health disorder? Do you want people making decisions for you? No. All right? So self-care determination and life planning. Advocacy is going to be on the board. So discuss identified treatment options. And look, respect their decision. That's huge. The board is telling you, I'm going to get you. I'm going to give you a scenario. I'm going to jam you up. At the end, are you going to respect the client's wishes? Provide information on advocacy to staff members. That's clients' rights. You're not, if a patient has dementia and the patient is saying, nope, I don't want that. I do not want that. The patient is not being violent. The patient is saying, no, I don't want. You have to figure out a way to talk to the patient, or you have to reorient the patient. But at the end of the day, guys, clients have rights. You can't hold somebody's hand, shove something down their throat. No. That is not within the scope of our practice, ever. You need to call somebody. You need to advocate for that client. Call a family member. Call the physician to let the physician know what's going on. That's how you advocate. Advocate is not stuffing something down someone's throat or doing a procedure when the patient tells you no. Advocating for the client is calling the family member. Advocating for the client is calling the doctor, because they may have to change the level of care. Act in the role of the client advocate. That has to do a lot with DNRs, clients' rights. It's all about the client. And utilize advocacy resources appropriately, like the social worker. And one of the big things is a chain of command for abuse. Make sure, and I know they say we are mandated reporters, absolutely, but let your charge nurse know what's going on before you have the police coming into the building at 3:00 in the morning, and the nurse, the charge nurse doesn't know what's going on. The nursing supervisor doesn't know what's going on. Just the police are there now. Yes, we are mandated reporters. Absolutely. Okay, but you have to use your chain of command. Interpreters. If your patient speaks any language that if it's not English, you have to provide an interpreter and a medical interpreter. So you can't use a family member to interpret medical explanations, medical history and physicals. You cannot use a family member. You have to get a medical interpreter. And that is on the board. Okay, you have to get an interpreter, a medical interpreter. Okay. Assignments, delegation, and supervision. Again, look how many bullet points. 1, 2, 3, 4, 5, 6, 7, 8, 9. So identify tasks for assignments or delegation based on clients' needs. So that's now they have, it's called, I don't know if you guys have ever heard of team nursing. Team nursing, they have quite a few of these questions in Saunders. Team nursing is when you have one LPN, one nurse, two CNAs or one CNA, and you're working together to take care of large, maybe 10 to 12 patients. So you have to know what an appropriate assignment is. So you have to know what you can and cannot delegate. So delegation, what I would recommend, and I will send you guys a worksheet, is make a list of what can an RN do, what can an LPN do, and what a UAP can do. Like what is the scope of practice for a RN, scope of practice for LPN, scope of practice for a UAP. That's how you'll know if the assignment is appropriate. All right, delegate and assign appropriate tasks based on clients' needs. Do I want to delegate tube feeding to UAP, or do I want to delegate tube feeding to an LPN? So this is huge. So again, if you guys if you have the extra money, buy that priority book. It will help you a lot. And they're also their delegation books that you can purchase also if you're having a problem with delegation. Assign and supervise care of client. Supervise, there's steps to supervision. Look at my management of care video. There's steps to supervision. This one I like because the steps don't change. It's memorization. 2, 3. Now they may give you a synonym, but if you have the foundation, you'll be good. This is huge. Supervised care. So there are certain steps that you have to take when you're supervising the care after you have assigned a client to another nurse or LPN or UAP. Communicate tasks to be completed and report clients' concerns immediately. So you always want to tell a client, tell whoever you're delegating the assignment to, listen, if the patient's respirations are 25, come and get me right away. If you have a vital sign that is below 91, please come and get me right away. If you notice that there's no urine in the Foley, please come and get me right away. Organize workload to manage time effectively, guys. You have to write down your workload. Again, I'll give you an example of how to set up your day. I'll show you guys an example. Use the rights of delegation. There you go. Right task, right circumstance, right person, right directions / communication, right supervision, evaluation. That is a question on the board. It's a select all that apply. Evaluate delegated tasks to ensure correct completion of activity. That's just comes along with supervision. They want to know that you're properly supervising your staff. All right. Evaluate ability of staff members to perform assigned tasks, considering personnel's allowable task, duties, competencies, and ability to use sound judgment and decision making. Are you appropriately delegating? Are you using the correct personnel? So again, what I would do, what is the scope of practice of an RN, LPN, UAP? Now, for this, guys, I will send chapter 6. It tells you a nurse's scope of practice. Okay? You have to know the nurse's scope of practice. And also for the UAP, I will send you the Prometric skills list. So you'll know, okay, a UAP can do this. A CNA can do this. And evaluate effectiveness of staff members' time management skills. So time management skills, there's such thing as time savers, time wasters. Look in your ATI book for them. Time savers, time wasters, and write them over and over. Memorize them. Make them your screensaver. Case management, our favorite. Case management, very important person, guys. More important, in my opinion, when it comes to management of care than the physician. Case management is everything when it comes to management of care. So look at a video of a case manager and what she does, a nurse case manager. All right. Explore resources available. I'm going to tell you what those resources are going to be. Oxygen, physical therapy. It's going to be physical therapy, OT, occupational therapy, speech therapy, and nutrition. So think about your ADLs. ADLs. All right. That's what explore resources available. Assess the client's needs for materials and equipment. Oxygen, suction machine, wound care, supplies. A patient in NCLEX World, they get everything they need. Also, don't forget, if they have a hospice, if they have a 6 months to or less to live diagnosis, also hospice. Practice and advocate for cost-effective care. That means that the patient is being discharged appropriately with all of these resources before they go home. Also, PPE. You have to know when to use it, when you should not use it, when to use and when not to use. Individualized care for a client based on need. So, client diagnosis, plan individualized care for CHF, plan individualized care for diabetes management, plan individualized care for client needs such as self-care ability, prescribe treatments. Provide client with information on discharge procedures to home or community settings, and initiate, evaluate, and update the client's plan of care. Client's rights. Look at that. Recognize the client's rights to refuse treatment and procedure. This is even my mental health client. This is even from my elderly client. They have a right to refuse. Discuss treatment options, decisions with client. Yes. Sometimes a patient may want chemo, maybe they don't want chemo. It is the patient's decision. Provide education to clients and staff about clients' rights and responsibilities. Client have rights. They have responsibilities also, like fall risk, or make sure that they understand they have bleeding precautions or seizure precautions. And evaluate client staff understanding of clients' rights. Advocate for clients' rights and needs. That comes along with ethics like DNR. If the client says, listen, you can throw that DNR away, I want to live, then we have to respect that. Now, collaboration with the interdisciplinary team. The big thing here is knowing what each team member is responsible for. So identify the need for interdisciplinary conferences. That means that if the plan of care is not complete, then everyone needs to get together and decide what they need to do for that client, especially, guys, when it comes to like hospice clients or newly diagnosed clients, and there's like some type of ethical dilemma. Sometimes you may need to consult wound care or speech therapists or speech pathologists. Identify significant information to report to other disciplines. Remember, SBAR, situation, background, assessment, and your recommendation. So this is SBAR. Review plan of care to ensure continuity across discipline. Make sure that if the client needs oxygen, you need to contact the case manager. If the client fails a swallow eval, you need to contact the speech pathologist. Collaborate with interprofessional team members when providing care. You have to know if the patient is unable, if they're recovering from a stroke and they have left side weakness, then I need to contact occupational therapy and physical therapy. Serve as a resource person to other staff. So you have to know, okay, yes, he's having left-sided weakness. He's recovering from a stroke. He was diagnosed with a stroke. He's recovering now. He's going to go to rehab for occupational therapy and physical therapy. Concepts of management. Identify roles and responsibilities of the healthcare team members. You need to know about case manager, speech pathologist, occupational therapist, physical therapist. Provide overall strategies to address clients' problems. Act as a liaison between client and others. So we manage care. We do act, especially if the client needs to go home with oxygen, or the client has to go home with wound care. Manage conflict. So I want to circle this. So let's do our numbers 2, 3, 4. So number 4, conflict resolution. It doesn't change. And evaluate management outcomes. Did it work? Did the conflict resolution, are things better? Confidentiality, information security, guys. Assess staff members and clients' understanding of confidentiality requirements. That means not posting things on social media, not allowing other people to read your client's chart if they're not involved in the care. Logging off of the computer when you're finished. You see, maintains confidentiality and privacy. Intervene appropriately. Now, this is the doozy. How do I approach the situation? First of all, I close my computer. If I have if someone has a PHI, personal health information, I ask for the personal health information. I shred the personal health information. And as far as student nurses, guys, student nurses should not have patients' charts, copies of patients' charts in the theoretical world without the permission of the client. They should never, ever, ever just go into a chart and start making copies. All of that, the client may not want a student to know their private health information. Now, this is the hardest part. If you guys have given report in the hospital, it'll be a lot easier. But if you haven't, you may find that this is kind of difficult. You have to know what information should be given if you're going to transfer a patient. So handoff reports. What should I add? Look at my video on management of care. It gives you a very good breakdown, and a worksheet is there. Use documents to record and communicate client needs. So there's a transfer form, there's a referral form in ATI. They have a very good example of a transfer form and referral form. Abbreviations. I'll send you guys a copy. Just keep in mind, medications should not be abbreviated. Again, perform procedures necessary to safely admit, transfer, or discharge a client. And look, they put this around it. There's an asterisk. That means that's a heavy hitter. So look at the video on management of care, because I really, really talked about that a lot. And follow up on unresolved issues regarding client's care. So lab results. Your lab value should be on sticky notes in your bathroom or on your refrigerator by now. You see? Lab results. How do I know the patient is declining, or how do I know that the labs are not within definable limits if I don't know the definable limits. So remember your sticky notes. Establishing priorities. This is what we do all day, nurses. Listen to this, guys. This is you. It says apply knowledge of pathophysiology. So CHF, diabetes mellitus. Patient may have asthma. Patient may have an MI. Patient may have stroke. So these are all the patients that they expect for you to prioritize. Because that's what, as nurses, this may be my patient list tonight. So apply knowledge of pathophysiology when establishing priorities. So who needs me first? So if you need help with this, there's a book. There's a book that will help you prioritize your care. Prioritize the delivery of client care. You have to know, am I going to my CHF patient first? Am I going to my diabetes mellitus? Am I going to my asthma patient? They're going to throw in lab values. They're going to throw in signs and symptoms. And you have to determine, I need to go see that patient first. Evaluate plan of care for multiple clients and revise plan of care. Again, you're going to get a lot of clients in one question, one scenario. You have to know who to care for first. Ethical practices. There are dilemmas. What I want you guys to remember is ethical dilemmas, take appropriate action. This normally, the question that they give you is your patient who is a DNR and there's a healthcare proxy. Inform client staff members of ethical issues affecting client care. Yes, sometimes there's an issue with the DNR. Practice in a manner consistent with codes of ethics for nurses. So that means that you're not witnessing, you're not going to allow a patient to put you in their will. It's just things like that. Codes of ethics for nurses. It's just certain things we can't do. Evaluate outcomes of interventions to promote ethical practice. So always look at the outcomes. Is the patient happy? Is the patient okay with the decision that we made? Informed consent. Like I said, guys, there are some facilities that don't even allow the nurses to take informed consent anymore. They want the doctor to go in. But if you, in NCLEX world, you have to verify that the information was given to the client. Okay? Identify appropriate person to provide informed consent for client. So who is signing the consent? Provide written materials in client spoken language. Describe components of the informed consent. Participate in obtaining informed consent, meaning that I'll walk into the room after the doctor. So this is the doctor. The doctor will tell me, go and get the informed consent after he has explained everything. This is when I come in. So he's first. I'm going to do my little checks, and then I'm second. Because verify the client receives appropriate education. Information technology. You have to know how to transcribe orders. So that's Tramped. That's what I use, Tramped. This is huge, guys. You have to know how to take an order. Apply knowledge of facility regulations when assessing clients' records. So if you're not working with that client, you should not be in that client's medical record. And assess data for clients through online database and journals. Look at the management of care review that I gave you guys. I have a list there of online databases and journals. Enter computer documentation accurately, completely, and in a timely manner. So you're supposed to do a procedure. You're supposed to do an intervention and then chart it. That's how it goes. Intervention, chart. Intervention, chart. You're not supposed to wait until the last 2 hours of your shift. And evidence-based research, information technology, policies, and procedures. Now, this is huge. Legal rights and responsibilities. Identified legal issues affecting the client. So, refusing the treatment. That comes along with if the patient is competent or incompetent. Now, you know, an incompetent patient has to be deemed incompetent by a judge. Clients' valuables. That means hearing aids and dentures. They're expensive. All right. Hearing aids and dentures. You have to keep track of that client's valuables. Recognize limitation of self and others and utilize resources. That's your delegation. Do not delegate Foley care or do not delegate insertion of a Foley to a UAP. That's delegation. Review facility policies and legal considerations prior to agreeing to serve as an interpreter for staff or primary healthcare provider. You should get a medical interpreter. Okay, so throughout my shift, guys, I can say a few things. I can say donde está. I can say dolor. I can say agua. I can say comida. Things like that, right? Should I be interpreting? Like, am I fluent? Now, do I need I can say manger, right? I can point to the water and say, you know, do you want some water? So I don't have to go get an interpreter for that. You guys get me? If you speak Creole and your patient is getting out of the bed and you know your patient is going to fall, do I got to get an interpreter to tell the patient don't fall in Creole? Or can I just say that? But when it comes to a medical diagnosis, when it comes to a procedure, when it comes to an operation, I need to go get a medical interpreter. Let's say, for instance, if you have a child at the bedside and the child speaks Spanish and you can say, can you ask your mom if she wants to take a shower now? That's okay. Should I be explaining a terp? Should I tell him to explain the terp to his father? No. So, you know, you can use, if you speak a second language, that's ideal. That's beautiful. You will get through the shift so much easier. I wish I knew Creole. I wish I knew Spanish. Okay. But when it comes to a medical procedure, when it comes to explaining a medical procedure with steps and that can cause harm, it has risk and benefits. Do you really want to be the interpreter for that? Do you really want to put yourself in that position? So get a medical interpreter. All right. Educate client and staff on legal issues. That's going to be malpractice versus non-malfeasance. You have to know the difference. Report clients' conditions as required by law. So that's going to be abuse and neglect and communicable diseases, guys. You absolutely do not need to ask the client's permission. So the communicable diseases, I will send you a little worksheet. And provide care within the legal scope of practice. And I want you guys to actually read it. Read your legal scope of practice. And it will help you with this section. Performance improvement, quality improvement. Don't overlook it. All right. If you look at my video, Management of Care, I did a very good breakdown of performance improvement, quality assurance activities, because we have to participate in performance improvement projects. We have to participate in quality improvement projects. That is why we go to huddles every day. That is why we have to do those online learning, e-learning. because we are mandated to participate in performance improvement projects. We are what drives the profession. Report identified client care issues, problems to appropriate personnel. Utilize research and other references for performance improvement actions. I have a list of credible sources that they want us to use. Evaluate the impact of performance improvement measures on client care and resource utilization. Did it work? Are the measures working? Is it getting better? And the last piece is referrals. Assess the need to refer clients for assistance with actual or potential problems. So, does this patient need physical therapy? Does the patient need speech therapy? So, assess the need for referrals and obtain necessary orders. That's our responsibility. Remember respite care. That is for the family member who is overwhelmed and needs a break. And identify which documents to include when referring a client. So the medical record, the referral form. So let's just do an example. The NCLEX even gave you a sample item. So the nurse has been made aware of the following client situations. The nurse should first assess the client with diverticulitis, who is reporting left lower quadrant pain. The nurse should first assess the client with COPD, who is reporting bloody sputum. The nurse should first assess the client who had an evacuation of a subdural hematoma 8 hours ago and has become agitated, or the client who had a total knee replacement 8 hours ago whose affected extremity is internally rotated. Now that's rough. Which one? Which one do you guys think? Oh, it has it here. It's 3. Because this guy, think about life over limb, right? Life over limb. Am I right? Subdural hematoma as opposed to a limb. Remember the principle life over limb? So I don't want you to get discouraged. I don't want you to get discouraged. I want you to go and look at that management of care lecture that I have. It's going to help you with the priority. And also there's a book that will help you with prioritizing your care. Okay. All right, guys. I want to finish this series. So on Thursday, we're gonna do. We may do it when I may have to do a video on Wednesday, Thursday, and Friday. Can you believe I'm off? Well, not technically off, but you guys know off means I do only one job. So Wednesday, Thursday, and Friday, I'm going to finish this series. All right. So if you can come, you can come. If you can't, I understand. On Monday, if you need to talk to me individually, that's when I am completely free to talk to you on Monday. Okay? Any questions from I'll send you as soon as I find out on Tuesday what they're gonna do with me. I'll let you guys know. But I want to finish this NCSBN for you. I want to do that together. So for now, you know how to do it on your own. Now you know how to go through and rank yourself. Are you 80%, 70%, 40% on all 8 client needs areas? All right. So we're gonna be talking a lot next week. So just I'll send you guys the alert either through Facebook or you can find me on YouTube, but I'll make sure I send you an email. I know you guys have to work. I know you guys have things to do. The recordings will always be on YouTube. All right, guys. See you later. Continue with your NCSBN test plan. Finish the whole thing. Do your check marks. All right, guys. See you later.